Hi, my name is Dave Kahn, and I'm an instructor here at Austin Medical Assistant Training. I teach the medical assistant program, I teach phlebotomy, I teach EKG, I teach billing and coding. One of the things that I love about Austin Medical Training, I've worked in other schools that have large populations, sometimes 20, 30. At times I've actually taught 40 students. You know, I have adjunct privileges at community colleges where they have large amounts of students in classes. One thing I like about Austin Medical Training is that the classrooms are very small, meaning that it allows the teachers to actually focus more on the students, providing them with all the with the essential information that they need in a more one-to-one type of setting versus having so many different students trying to get everything. You always will have students that, in a group of 20, 25 people, you may have like 5 people where may struggle with getting the information. And unfortunately, in large settings like that, you kind of have to move with the masses. So if 20 students are actually getting the information and 5 aren't, they kind of get left behind. But here, because the student population in the classes are a lot smaller, all right, 5, 10 students the most, you're actually able to actually dedicate more time to each student. And as far as the quality of education, it allows the instructors to actually provide more information to the students, both information as far as the classroom, the lecture, the theory aspect of it, as well as the clinical aspect. And that's another good thing about this school, is that because we do have because the school does have the ability at times to integrate the students into an actual office setting, it gives the students much more hands-on experience as opposed to traditional schools where everything is done in a simulated settings with other students. Here we actually have the ability to get students to interact with patients on certain occasions, and because we do have smaller groups, it allows us to focus as educators on actual important aspects of the clinical setting that will actually be used in the realistic world. They get to see how it is to work in a doctor's office. They get to integrate with actual medical assistants who have been students here at the program and are working as medical assistants here in the office. So it does give the students a lot more ability, especially how our classes are set up, where we do, clinical classes, we dedicate hours of time to the hands-on setting. It gives the students much more practice, which will make a better medical assistant, will make a better phlebotomist, EKG technician. Even with the billing and coding, they get the hands-on experience. It will make them more marketable upon completion of the program.
As I looked at the class size and the benefits that would provide me in the future, I saw that the one-on-one instruction, the ability to take the training that I had learned in classroom and actually bring it to a real-life doctor's office environment within the school far surpassed any school that was out there right now.
Lo que más me gustó del programa fue que al principio tenía muy atareado mi horario entre mis labores y mis cuestiones personales, pero me ofrecieron darme las clases al horario que yo podía y se ataron a mi flexibilidad.
We get the experience in the exam rooms where it makes us not nervous as for when we are in the actual field dealing with the same type of exam rooms. We're already comfortable in the setting because we've practiced in that type of setting.